I am the program lead of the Climate and Health Research Lab at OFSN. I would just like to welcome you all and thank you for joining. And right now I will hand over to Damilola, who is the Executive Director. Thank you.
Hello, everyone. Sorry for the little delay that we had in the beginning. I would love to welcome all of you to the fall 2022 Climate and Health Research Lab program. We are glad to have as many of you here today. We are still expecting more people to join because we had tons and tons of registrations. So today we are going to be doing a little bit of an onboarding session before we have the first training. So please stay a little bit. And before we get into that, I can see that some of you are already trying to introduce yourself in the chat. Please continue to do so. Please continue to do so while we continue. I am just going to share my screen and we were able to train and help 100 youths to conduct research. And just this year, we restructured the program to conduct trainings first and then the research program later. These are some of the details that I will be getting into. But before that, I would love to introduce the amazing team that have worked to put all of this together, the people that you've been communicating with, that you've been chatting with. So the first person, of course, is Mutile Mwongo. She is the program lead. And I know so many of you have been communicating with her, asking her questions, and you would continue to do so during the course of this program. And second person is Zimi Oladeji, is the communications lead. We have Elona Erezi, she's the partnerships coordinator. And then we have Mutsa Motsi, who is the recruitment and database manager. So to give you a little bit of introduction into what the program is generally, like why exactly are we here and how did we get here? So the lab was established in 2003, just like I said earlier, and we are using the program to bridge the gap of climate and health scientific literature between the high-income countries and low and middle-income countries. Most of the research and evidence and knowledge that is presently existing are much more in high-income countries than low and middle-income countries. And we believe that without a lack of evidence, we would not have the necessary information to be able to understand how climate change duly affects health outcomes in all of these low-income countries. So we created the program to help youth to build the capacity of youth to conduct research through training and mentoring. And for the past 1 year, we have been training youths between the ages of 18 to 35 years old, regardless of their discipline, to conduct research at the intersection of climate change and health, with a focus on low and middle income countries. So just like I said earlier, the program has two phases. The first phase is the research training phase, and the second one is the research mentorship. So the research training, which is what we are getting started here today, it's a 4-week structured program that has 6-part training. So the very first training is what you guys are going to be experiencing here today. And we've structured this training in such a way that it would be easy for youth to understand how to conduct research. And we definitely understand that research isn't something very easy that you will just get started with and within 1 month you're going to be a pro. And that is the reason why we still mentor you through the research in the second phase of the program, which runs for about 16 weeks. So this program would only select 50 participants, but those 50 participants will be selected from people that have already gone through the training. And I will get into the details of that in a little bit. So the participants that we bring into this program are young people between the ages of 18 to 35 years old. And the reason why we have that age bracket is because we believe that these are the young people that are at the forefront of climate crisis. And they've also been the one that have been fighting for their future, and they need to understand how climate change exactly affects the health of young people, and how it's responsible for so many environmental justice issues. And we also bring in, we have to make sure that there are people that are interested in conducting research in climate change and health. At the intersection of climate change and health, we focus on low and middle income countries. And just like I also mentioned earlier, we bring in youth from, regardless of their disciplinary backgrounds. And we also love to have youths that have life experience, people that have experienced climate change impact. So the training objectives is, of course, for us to enhance your understanding of the intersection between climate change and health. What are the health outcomes that are most common in low and middle income countries? The second one is to develop your research skills, for you to understand the necessary skills, methodology for putting together a research review, to disseminating research, and even the ethics in research. And the third one being to foster collaboration among youths all around the world. And, fostering the collaboration is something that would also help them conduct research and collaborate for research, which is something that we host at the Oath for Sustainability Network. And finally, to promote practical application. So how exactly do you, take your abstract and present at conferences, or you make a poster presentation? Those are some of the things that we are going to help and guide you with during this training program. So the training outline for this fall 2024 is 6, just like I mentioned earlier. And here are the dates that all of those training are going to be happening. So the first one that you're going to be having today is the climate and health, like general introduction to climate change and health, with a focus on low and middle income countries and why research is important. And then the second one is research design and methodology, which is going to be happening, which will be the next training. And then the third one is the data collection and management, data analysis and interpretation, dissemination and ethics and research writing. Then lastly is the policy management in climate and health, which would be the last training happening on the 24th of August. So the training structure is about 90 minutes long for each one of the sessions, and it will include lectures from the speakers that we've invited, interactive discussion, Q&A segment, and some practical exercises as some of the speakers might see fit. And all of these trainings are going to be happening on Thursdays and Saturdays. So would have sent you a calendar for you to RSVP with. So make sure you RSVP with us so that you would not miss any one of the trainings. And we are bringing in guest speakers who are experts in climate change and health research. So at the end of this program, participants are required to earn certificates, but there are some little requirements that you would have to, fulfill before you are able to earn a certificate on this program. So the first one is, we would want you to join at least 4 live Zoom trainings. We have 6 trainings, but we would want you to join at least 4 live Zoom trainings. The Zoom automatically takes attendance of people that join, so we would see if you joined at least 4 or not. And at the end of the program, we are going to have an evaluation of questions about all the trainings that you've taken on the program. So for people who score at least 80% are the ones that are going to earn the certificate at the end. So for attendance, some of the things we would love you to know about attendance on the program is also that all sessions are going to be recorded and uploaded on YouTube. But if you are unable to join the live session and you watch the YouTube recording later, that doesn't count as an attendance. Only those who join the live Zoom trainings will be counted as attendance. The only reason why the YouTube recording is important is because by the time you would want to take the end of course evaluation, if you missed any training, you might just want to go and catch up to be able to understand what they said in that training and be able to answer the questions in the end of program evaluation. So ensure that you try to RSVP for all of those meetings and join all the trainings if possible, but make sure you join at least 4 of them. So we'll give about a week at the end of the program to disburse certificates. So what we are going to do is we are going to issue all the certificates from between the 5th to 9th of September 2024. So the research mentorship program that I mentioned earlier is going to start immediately after this research training. And everybody that is participating in this research training right now is eligible to apply for the research program. But only people that are able to earn certificates from the research training will be considered on the research mentorship program. I'll repeat that again. Everybody, all participants on this research training are eligible to apply for the research mentorship program, but only people who earn at least 80%, therefore earning certificates on the research training, will be considered for the research program. It doesn't give you, for the research mentorship program, it doesn't give you an automatic entry into the research mentorship. Just like I said earlier, we're only choosing 50 people to conduct research in teams, and you must be ready to commit at least 16 weeks to conduct intensive and rigorous secondary research. So after the research mentorship program as well, you'll be earning another certificate just for the research mentorship after you've conducted research. But only those who are selected for that program will get the nitty and gritty details of the research mentorship. So thank you so much for going through all that presentation. And we believe that after this, most of you are going to have questions. You would want to know what is going on. So if you have any question at all, please send an email directly to the lab's email, which is climatehealthlabofsn@gmail.com. And for links and even this presentation, we are going to be sending it to you immediately after this training session. Thank you. Mutile, you have the floor.
Great. Thank you so much, Dami, for the introduction. I hope we all have a bit of an idea what we are doing here and how this program will run. And so now we're going to pretty much get into the main part of the session. And we're going to start with a quick icebreaker or pace setting for this session. So in one word, could you just let us know what your expectations are from the program based on everything you've heard so far? And then secondly, what you're passionate about in climate and health. So what are your expectations and what you're passionate about? And then we'll just read some responses from the chat and then open the floor for our speaker today. So I'll just keep an eye on the chat. Okay, I see someone interested in innovation and research tactics. I'm so sorry, I forgot to turn on my video. Skill development, learning and applying skills. I see to become a research expert. That's a good ambition. Better understanding of the circumstances of climate change, to learn about the intersection of climate change and health, to improve data analysis. Great. These are all some of the things that we hope to touch on during the research program, both the training and the mentorship. And I think this is just a good starting point to introduce our speaker for today, who is Dr. Harshita. Dr. Harshita is, I'm just going to quickly read her bio in 1 minute. Dr. Harshita, if you could come on the screen, we would appreciate that.
Hi.
Great, thank you so much. So Dr. Harshita is the co-contact point of the Young Health Working Group, which is part of the UNFCCC, and she's the founder of VADA. She is a former youth policy champion for sexual and reproductive health rights with the Youth Key Ball Coalition at UNICEF India. She is a research enthusiast and serves as a youth advisor to the Children's Cities and Climate Action Lab at the London School of Health and Tropical Medicine. She is also a certified public health and disaster medicine trainer, a strong advocate for mental health, SRHR, and climate change, and has been a delegate and speaker at numerous UN conferences, including Groundwater as a Key to Sustainable Development Goals Conference, the UN Water Conference, the 7th Global Platform for Disaster Risk Reduction, the Global Forum for Adolescents, regional committee meetings of WHO, and the Commission on Status of Women. So welcome, Dr. Harshita. She's going to take us through the introduction to climate and health. And if you'd like to maybe do a brief introduction, I can get your slides up on the screen.
Sure. Thank you so much, Dami, I think, and the OFSN. This is the second time actually that I've been speaking at the OFSN. Last year was part of the 16-week-long research thing that happened where I took a topic. So I'm thrilled to be back and to see that you've had such immense support. To everybody who's listening over here, the baseline knowledge for all of us is different. So I'm a medical doctor by profession, and as they've mentioned, I also work in the public health space. So when I started learning about climate change and its intersectionality of health, I already knew about health, so I started learning about things in climate change. But there'll be probably people here who know more things about climate change and people who might not know about health. So my request to everybody is some of the topics that we'll be covering today might be very basic, but this is because I want all of you to have this brief overview entirely and try to make these linkages. And it's since we have about 45 minutes and we want to make this slightly interactive, I'm not going to be able to touch upon everything, but I will be sharing some resources that we can utilize and we can take forward. And I'll drop my LinkedIn and my email if you guys want to connect later or ask me any questions. So the introduction to climate change and health. Before we delve into this, does anybody want to tell me what they think about when you hear the terms climate change and health? We can do a Mentimeter as well if you'd like, but quickly in the chat, I'll give you guys about 2 minutes. Can we just go back one slide? Okay, health is the face of climate change. I wouldn't say that entirely. While the Lancet has declared that the climate crisis is also a health crisis, it was only a decade or two back that they actually realized this. So it's not always been the face of, the climate change. Definitely amplified inequalities, definitely affects our normal body functioning. Okay, wow, you guys are already experts. I'm not really sure why you need me here. But either way, what we're going to do first, next slide, please, is go through the terminology related to climate change and health. I've put a couple on the slide over here. Everything that's in red is your climate change terminology, which is very frequently used in whether it's policy briefs or research papers or even at negotiations and side events at conferences. So I feel like it's very important for us to know about these differences. So adaptation is basically how are we adapting or how are we suiting the needs better to the environment that's already present. The difference between climate and weather is something that's short term, climate is something that's on a long term. When we talk about food security is about mainly related to food systems. And it's about, do we have enough agricultural produce? And is this nutritious for us? Because we are health professionals over here. Fossil fuels. The reason that we're talking about this here today, the reason I've added fossil fuels here is because I wanted to draw your attention to something that's very important, which is about the fossil fuel treaty and what's happened in the past few COPs and SBs and is being negotiated right now. One of the biggest contributors to climate change is fossil fuels, but everybody has been pushing rather for a fossil fuel phase out. But what we got was a fossil fuel phase down. And what this means is that global north and global south countries have agreed that, okay, we need to reduce our emissions, we need to reduce our dependence on fossil fuels, but they haven't agreed on when that they want to have that to happen and when they're going to completely phase it out and utilize renewable energy resources and have like a very just transition that is happening. Loss and damage. The most important thing about loss and damage is that the loss and damage is something that the global south, especially the low and middle income countries, have been asking for a while. And last year at COP, we actually had the first loss and damage fund. But the reason that this is so relevant to us in the health space is even though we have this fund, less than 1% of financing from that fund is allocated towards healthcare systems and healthcare resources. So that becomes extremely problematic because it means that countries are not prioritizing health. Mitigation is how we're reducing the severity of what's impacting us. National determined contributions. Now, this is extremely important because most NDCs, about 70% of them, have some mention of health. So I know that all of us here we're from different countries. One thing that we can do after we end this session and we go back is to see how health has been mentioned in our particular national determined contribution. And this relates very closely to our national action plans. So I want you to go back and see how it's related to our national action plans. In which context has health been mentioned in the national action plans? Water security, because obviously this is going to really affect how we have access to safe water resources. And finally, we come to the health terminology. So yeah. So when we talk about the climate and health terminology, there's some kind of an overlap, and these are the terms that you'll see very often. Obviously, this list is not very comprehensive, but I wanted to like draw your note to some of these things. The first thing would be about the climate and health co-benefit. When we talk about co-benefits, we talk about, okay, so we have climate change on one side and we have health on the other. If we work either on climate change or we work on health, it can mutually benefit each other. So how do we make policies? How do we do advocacy efforts? How do we do initiatives that come out with benefits that are mutual to both? So that's basically about co-benefits. For example, reduction in respiratory diseases such as asthma, which would by reducing air pollution. All right. Then climate sensitive diseases. Now, most diseases are climate sensitive, but you have some diseases which are directly related to climate change, would be something like heat, but something which has a changing pattern. For example, malaria, dengue, and all of that. They come from vector-borne diseases, right? So they're coming from your mosquitoes. Now, your mosquitoes breed in tropical grounds. So if climate changes and weathers become warmer, that means the breeding grounds for these mosquitoes will increase, which means diseases which were endemic, located or seen most commonly in some countries, will no longer be seen only in those countries, but it will expand to other countries as well. And that brings us to what is a disease burden. A disease burden would be the impact that's measured, whether it's in morbidity, mortality, disability adjusted life years, so on and so forth. So it's basically how are you quantifying this? It's not just about the quality of life that you're having, but you're trying to quantify its impacts on you as well. And then infectious diseases. So anything that's infectious is something that is transmissible. So it's caused by bacteria, viruses, fungi, and their own, each of them have their own diseases. I will come back to One Health and planetary health because we're talking about it in the next slide. But somebody mentioned before that when we talk about climate change and health, we talk about how it increases inequalities. And one of the ways that we look at this from the health angle is social determinants of health, your socioeconomic status, living conditions, housing, availability of water resources around you, your nutrition, the kind of occupation that you do. For example, if somebody is working in the mining industry, they'd be more likely to get a lung cancer when compared to somebody who's just been staying away and staying at home, right? So these are some social determinants of health. Next slide, please. So here you can see the difference between One Health and planetary health, but I'm just going to go a little step back and talk to you about public health. Public health is when you look at it in a small focus, right? As you can see over there. So you're talking about maybe a particular country, you're talking about a particular context, and you're looking at it in viewed with that. Global health is when you consider the whole world and you say, okay, there are these health inequities, the global agenda is so on and so forth. The reason we talk about public health is because each country or each region has its own priorities. It doesn't make sense for me to go to the US and talk about something like malaria when they barely have any of those diseases. They don't have that disease burden in that country. And it doesn't make sense for them to invest so much in that. But when you come to countries like India or South Asia, Southeast Asia, Africa, the burden of disease is much higher over here. For example, it wouldn't make sense for me to maybe talk about something like obesity in the context of Africa. So that's the difference between public health and global health. But when you talk about global health, you look at this disease as like a overall thing. Okay, so how many people have died from a particular disease? Or what is the trend of this particular disease that is happening? How am I moving forward from here? And if I want to maintain SDG number 3, which is good health and well-being, and achieve the targets, what are how are my indicators looking so far? What targets have I reached? What is the issues that I'm facing that I'm not able to reach my target for it? How One Health relates to this is that One Health realizes that human health is impacted by the health of the environment and the health of animals as well. So when you look at all of it, human, environment, and animal, it's called One Health. Now, you can see the slide over here where it shows you a couple of intersectionalities between human health and animal health. But one example I think that all of us would know is COVID-19, right? So COVID-19, it was a virus, the coronavirus, but the coronavirus has caused diseases in mankind before. The reason this became an epidemic and we had like the lockdown and quarantine measures put in place is because this virus mutated. It was first seen in an animal and then it came to us human beings. So it's important for us to actually protect, the animal's health. It's important for us to protect, human health, but it's also important for us to protect environmental health because it's a cycle, right? So one affects the other. But when we look about at the environment, a growing and emerging concept in research right now is the planetary health. And there's an alliance called the Planetary Health Alliance, which has like a bunch of organizations, at least more than 50 of them, which are looking at this concept as saying that, okay, the environment of the planet overall is what we need to consider and not these things separately. Next slide, please. So I'm going to go a little bit into the basic science of climate change now. Next slide, please. Does anybody recognize this graph? Have you seen it before? Okay. Does anyone want to comment about on this graph? Like, do you want to like unmute yourselves? No? Okay. Well, when we look at this graph, like we can, we can't unmute. No worries, I will explain. When we look at this graph, we can actually see how the global temperature has risen and yes.
Oh yes, allowed me to unmute. Okay,
You want
I'll
to
just
explain about the
yeah, I'll
graph?
give it a go. I'll sit. When we look at this graph, we can see that the global temperature since 1980 has risen at a rate that is unparalleled in the previous decades. And it reached very high temperatures. Yep. The change. Okay, because looking at the global temperature anomalies. So yeah, you have experienced more anomalies that are in the positive direction relative to previous decades. It's unprecedented. You haven't had negatives, and they're actually much bigger than you've seen in previous years. That's what I see.
You're absolutely right. We each, okay, how many of us, just raise your hands, keep hearing this is the hottest day on earth, this is the hottest month on earth, and you just keep hearing it again, right? I find that extremely funny because we keep hearing about it, but very few people are actually doing something about it. Governments and negotiators wise. What this graph really shows us is not only about how fast the change has happened, but also about how alarming it is. Because when we look at the 1980s, that's when we had the Industrial Revolution. My bad, sorry. We had the Industrial Revolution. And when we hear the Industrial Revolution, that's when we had all of these fossil fuels and everything that started coming into the place. And we can see that, when we put in certain measures, then the graph has decreased slightly. But now the graph keeps increasing. And that's what's alarming, right? Because COVID hit around somewhere around 2020, and it fell, you know, the temperatures around the world, it felt cooler, it felt better because we were all just stuck at home, and the earth started healing itself. Like I could literally smell the difference in the air around me. I'm pretty sure a lot of us agree with this particular point. But what that goes to show is that there is still hope. Next slide, please. So this is literally the same thing that's condensed. But over here, we can see that if we don't really do something about this now, it's gonna impact us terribly. So the Paris Agreement that was signed is where you have the United Nations Framework Convention on Climate Change that came out. And the parties that signed onto it became the Conference of Parties that's held every single year in a different country. And what they actually signed and agreed to do was to honor the commitments to limit the warming to less than 2 degrees Celsius. We are saying no, we want it to less than 1.5 degrees Celsius, but they've agreed for 2 degrees Celsius. But even now, even if we limit all of our national determined contributions at the rate at which they're going, even by the year 2100, it's not sufficient because it will rise up to 3.2 degrees Celsius. So that's what this is trying to explain, that the warming is going to continue. And once it reaches that very critical point of or 1.5, where we are, we're going to have a lot of systems dying, whether it's coral reefs, it's ocean acidification that's happening, it's groundwater levels depleting, it's a changing of the atmosphere around us, no matter what it is. But at 2 degrees Celsius, it's irreversible. So that's what this graph is trying to show, right? Like, what is the level of the future emission scenario, and how does that really impact the temperature rises that's going to happen in the future? Next slide, please. But if you look at this particular slide, now we talked about the changes in the temperature. What we need to realize is that these changes in the temperature, it's not uniform throughout the globe. And at different levels of rise, whether it's your 25th percentile, the 75th percentile, different countries are affected differently. And that becomes so much more significant because the kind of diseases that we will experience, the kind of heat-related illnesses, waterborne diseases, food insecurities, all of that is completely dependent on this change in temperature, but this unequal change in temperature. So when we're considering doing research, it's important for us to note that there are these inequalities that are already present. And so when we have strategies like adaptation, mitigation, these initiatives, it needs to be targeted differently for different countries. Next slide, please. So how does climate change really affect health? Next slide, please. The World Health Organization estimates approximately 250,000 deaths annually between 230 to 250 between the years of 230 to 250. But all of these are related to heat exposure, and it's extremely significant in children and elderly populations. And this also has differential increases in diseases like diarrhea, malaria, dengue, flooding, and all of that. So what this slide is really looking at is how is this particular climate change affecting when it looks at the thing. So here we see the glaciers are melting, we see altered surface water, and these are the primary environmental impacts. But you can have the direct ones, right? Such as injury and death, so on and so forth. And then it comes down. So if you have something that's affecting, let's say we have a wildfire, the direct and immediate the effects would be something like you would have burns, you might die from it. If debris falls on you, you might have fractures, so on and so forth. A long-term consequence, an intermediate-term consequence rather, would be probably because of the air pollution, smoke inhalation, you'll probably have some damage to your lungs. So you might have something like asthma. But then a long-term consequence of this would probably be something like cancer. So that's your short-term and long-term things, and how hygiene, for example, climate change, again, it's very related to SRHR, which is sexual and reproductive health rights. So if you have water scarcity, then you're obviously not going to be able to maintain the best of hygiene. So this means rashes or menstrual inequities in people, period poverty, exacerbations. And this is going to obviously result in relocation of people. And unfortunately, people displaced by climate change are not considered as refugees. So it's going to result in more conflicts, and this is going to result in a more protracted crises. Next slide, please. So this is just the same thing, but in a shorter, condensed version about how warmer seasons, temperature changes actually relate to this and the kind of impacts that we have, which is malnutrition, death or injury, mental disorders, infectious disease, cardiovascular diseases, so on and so forth. Next slide, please. I particularly like this slide because it focuses very specifically on the major health risks. So let's just take a minute and just decode the slide, right? So we have obviously the direct impacts, which include your injuries, fatalities, and stuff. Mental health research is something that's up and coming in the field. And heat-related illnesses, which is heat stroke and then heat-related death. So it starts as heat cramps and then goes to heat stroke and then reaches to death. Exacerbation of diseases because of air quality levels. So we keep hearing about AQI, which is the air quality index. So other infections, for example, so all these say Campylobacter, which is an organism that causes diarrheal disease, cholera. Cryptosporidiasis is a type of fungus which also causes diarrhea. Algal blooms, Leptospira is a spirochete. It causes pneumonia. Food security, which is related to malnutrition, undernutrition of children, and that increases your vulnerability to actually getting a disease because it lowers your immunity. Then your vector-borne diseases, which is dengue, malaria, chikungunya, encephalitis, filariasis, Zika virus, so on and so forth. And the social factors, which is all of these social determinants of health that we talked about, mental health, physical health and well-being, so on and so forth. So we can see that there are a lot of varieties of diseases that can be influenced. So if you want to choose a particular research topic, I think something that needs to be noted is if you're going to do something that's direct, something that's directly climate change and health related, something that's indirectly climate change and health related, or something that would be an inequality that you're addressing. Next slide, please. So this is just like a brief overview of climate change and health research that's happened in the past few years. Next slide, please. Oh no, the image is not seen. Okay, so there was an image, I'll probably share it again, but there's something known as the Global Burden of Disease Study. And what this has actually looked at is about all these diseases that we just spoke about, how it's different in different continents. I'm not sure how it got missed. Oh, it's here. Amazing. So yeah, you can see that there's Africa, America, EMRO, European, Southeast Asia, and Western Pacific, and this is divided based on the WHO regions. So we can see that certain countries, certain regions have increased susceptibility to certain diseases, whether it's vector-borne diseases like dengue and malaria, it's heat and cold exposure, it's diarrhea, protein energy malnutrition. So depending on that, we actually prioritize what research we want to do in which country. Next slide, please. And before we actually get to this research, we do something which is a hazard exposure and vulnerability mapping. So exposure is basically about how are you being exposed to this particular climate change related thing. The hazard is what exactly of that climate change thing is affecting you. And the vulnerability comes based on whether it's gender, age, mobility, the access to the care, your socioeconomic status, any pre-existing health conditions, and the health system that is already present in the particular country that we're looking at. And that's when you look at, okay, is this an effect on the system, or is this a climate sensitive outcome on the particular person or the disease or something that's already been present? Next slide, please. So this is what's happening globally. Now, who do we look to see about the most recent updates and so on and so forth? So the international engagements and the best people who've been speaking the most about this is obviously the parent body for climate change would be the UNFCCC, United Nations Framework Convention on Climate Change. And the IPCC, which is also the Intergovernmental Panel on Climate Change. But we also have the World Health Organization, which also is the main parent body for health-related stuff. And in the recent years, at least the past 2 years, I'll just go a little bit back. While the Lancet countdown and Lancet actually said that climate change is the biggest global health threat of the 21st century, and this was almost a decade back, it is only recently that people have that climate change and health have been started being negotiated on. So our COP26, which was held in Glasgow, we had the attached framework where a bunch of countries actually came together and they said, okay, we want to actually talk about, the sensitive diseases and climate related illnesses. And COP27 that happened in Sharm el-Sheikh, Egypt, there was the first ever WHO pavilion in COP. And finally, in COP28, we had the health declaration that was signed by almost 140 countries. So we can also go and Google back and see if our country has signed it or not. But from then onwards, it's been phenomenal because at the World Health Assembly that happened in Geneva this year, there was the first ever resolution that's been passed on climate change and health. And at Bonn, for the first time, it's been the child's rights and crises and their health in the scenario of climate change has a special focus on it. So we're looking forward to COP29 that's going to be held in Baku to see exactly what is going to happen, how will we ensuring the accountability of organizations that have signed the climate and health declaration and what that means for us. So this is something that's very brief. Next slide, please. Okay, so now we're going to go to like the case studies, and this is something that happened in India, which is the Ahmedabad Heat Action Plan, and it was done in the year 2016. What this was aimed at, and one of the most common reasons that people end up with heat strokes and heat-related illnesses is because they don't really know how to take care of themselves during a very hot season. For example, most people might not wear a cap, they might not drink water adequately, and even when you're drinking water, it's not enough because when you sweat, you end up losing minerals. So you need to hydrate yourself with something like juices or electrolytes and stuff. So what this action plan actually did, and this was a case study that was displayed at COP26 at Glasgow, was how are we capacity building and creating awareness among the public? What are the warning systems that can be implemented? And even for healthcare professionals to treat this, what are the things that they need to know? Because most health curricula across the world do not have climate change included in it. Of course, we touch upon it somewhere as environmental health, but it's not a deep dive and it's not something that's enforced. So the output and the outcome of what happened is that the number of deaths has decreased, and this is something that is scalable. So you can obviously do this at another country. Sorry for the background noise. So you can obviously do this at like another country or another city in India, just need the customization. And it is a successful adaptation measure. And it was done without external funding, which is also great because, let's face it, we're all poor. Next slide, please. This is vector-borne diseases, and this shows how temperature actually affects the vector-borne diseases and how the percentage of the viruses and the mosquitoes carrying them increased, and why the number of diseases also increased is because the transmission period and the season for that particular disease also increased. For example, I'm from India, so we have the monsoon season, which is our rainy season, and it has kind of just started and will go on for the next couple of months. For us as healthcare professionals and doctors, we call this the dengue season because we see a lot of dengue cases. But if climate change happens, you have the El Nino effect, so on and so forth, then the season's going to increase. And that means that we are prepared mentally. As soon as we know that, hey, monsoon is starting, dengue is going to start, and we stock up on our blood banks, we stock up on plasmas, we stock up on the required drugs and everything. But if that changes and year round we need these, that's going to be a huge burden on our healthcare systems. Next slide, please. So this is, again, about the dengue thing that I was telling you before, how the number has really changed and how it's being projected. But another thing is also diarrhea and waterborne diseases, because sanitation facilities and sanitary measures are not really well enforced when climate change happens, and that results in a lot of diarrheal diseases. Next slide, please. So this is my last case study, which is about climate change and mental health, which is a very up-and-coming research topic. Connecting Climate Minds is hosted at the Imperial College of London, funded by the Wellcome Trust. And they've started somewhat last year where they have like a global research agenda, and they also have regional research agendas. And as part of the regional pop-up dialogue that happened in India, what they're investigating is how exactly climate anxiety manifests in young people, what are their lived experiences, and what can be done to actually safeguard their psychological well-being. There is a lot of talk about loss and damage and the funding that comes for loss and damage, but something that is psychological, something that is mental, does not really get funding and adequate financing, because how can you really quantify it, right? So this particular research project tries to like come out with statistics and lived on ground realities, and how they show that, okay, climate change is also affecting mental health. There are terms like nostalgia, eco-anxiety, so on and so forth, and we can probably Google that on another time. But the slides stop sharing again. But the point remains that it's a very intricate intersectionality that's being explored right now, especially in low and middle income countries and global south countries. There's probably something that we might want to look into. Is somebody going to share my slides? Just have a couple of more.
Let me see how I can do that for you from here. So I'm not exactly sure what number you're on. So
The last but one slide.
oh, okay. Oh, okay, it's back.
Okay, no worries. Next slide, please. So as they mentioned, I'm the co-contact point for the health working group of Youngo, and Youngo is the official children and youth constituency to the UNFCCC. And this is something that we keep sharing opportunities about, whether it's about research, it's about initiatives that are ongoing, jobs in the climate and health space, so on and so forth. So there's a WhatsApp group where people who are just want to learn about stuff climate and health related can join. But if you want to join the active membership where we share about opportunities are more specific to Youngo and the health working group members, then you'll have to join Youngo through the website that I've shared, and finally fill out the active membership form, and we will add you to our mailing list and our WhatsApp group. So we're currently running a campaign called the Eco Resilience Campaign, which is being run also by we're supporting actually the Eco Anxiety Project based in Africa. One slide back, please. And so if you have a lived reality in the global south country and you want to show solidarity and tell people that, hey, despite all of these climate change impacts that are happening, I'm still hopeful, and this is what I'm doing, and this is why I'm hopeful, or I have this particular strategy that I'm doing to safeguard my mental health, you can reach us on Instagram, or you can text me and I will share the link to you, and you can record that and send it across. Next slide, please. So thank you. I hope now that nature really heals. And this is just a meme because I love ending things on a more positive note. So the crops are finally returning to the rivers. All right. I'm done. Thanks.
Amazing. Thank you so much, Dr. Harshita, and my apologies. I just kept on losing my connection. But that was a really interesting session. I think we've all learned a ton. I think we are ready to open the floor for questions, comments, any thoughts that you have about this whole intersection of climate change and health. So just for housekeeping, if you have a question, please raise your hand. We're going to see the queue and then we'll allow you to unmute yourself and go ahead. So unfortunately, it looks like all of the people who are named MM are anonymous to me. So if you're able to change your name, please do so that I can call you out. But I see two people named MM, so just one of you go ahead and ask your question.
Can I speak? Good morning, everyone. My name is Mrs. Pisipa Miche from Nigeria. I am a person with albinism. I noticed that throughout the discussion, nothing was mentioned about these vulnerable people. The impact of the climate change on our skin leads to skin cancer, but nothing was mentioned about it. So I would like the speaker to take note of that climate change effects on persons with albinism is very, very serious and very sympathetic, because here in Nigeria, every month, we lose about 2 of our members due to skin cancer. Thank you.
I absolutely agree with you about the skin cancer bit. Skin cancer, it's mainly related to the ozone layer and also depends on chemical exposure to certain environmental pollutants and hazards. As I was given only 30 to 45 minutes to talk, it was slightly more difficult for me to include everything into it. And I apologize for that, but I will try to make note of this and ensure that, in future I talk about this as well.
Thank you. I see another MM. So if you were second to raise your hand, go ahead.
Hello. Hello.
Hi, yes, we can hear you.
Yeah, okay, thank you. I am Dr. Bukola Popola from Nigeria also. I thank you for your lovely presentation. I would want to know, I'm a microbiologist. I was actually interested when you were talking about microorganisms, some diseases that are caused by microorganisms. So I actually want to know the impact of of climate change and microorganisms. What actually is the relationship? Is it that the climate change has negative, or the microorganism, so to say, has negative effect on the climate and the health?
So I haven't seen any literature on microorganisms affecting climate change, like the alternative. I might be mistaken, and it's probably some reading material for me. But something that I have seen is how climate change affects microorganisms. And this completely depends from microorganism to microorganism because there's so many. And then you have so many different classes like bacteria, viruses, fungi, prions, spirochetes, so on and so forth. Um, and each of these particular bacteria, they are whichever microorganism, they have their own relation to climate, not climate, rather to temperature. For example, when we talked about food security, one of the things, one of the things is also about okay, I'll put it this way. When you have a hot and wet environment, fungi grow very easily, right? So in climate, when the weather is actually becoming warmer and you stored away grains and stuff, the chances of it fungi attacking it are increased because the temperature and the conditions are more conducive to its growth. What that results is, even though you didn't have like food insecurity because you had underproduction, but you have food insecurity now because whatever has been produced is not being able to reach its resources. So that's also one thing. The other thing is the food that's being stored even at regular temperature, because it's more conducive for these microorganisms to grow. You have food that's being spoiled very easily and people developing food poisoning cases. So when we talk about climate and its effect to microorganisms or microbiology, it's a complete deep dive depending on which microorganisms or which system in the human body, for example, gastrointestinal, respiratory tract, so on and so forth. And I feel like it's a session that should be taken on its own. But I hope this gives you some kind of clarity.
Amazing response. So yeah, basically, since microorganisms live within the environment and the environment is affected by climate change, then that can impact their rates of transmission and their geographical distribution. Okay, I see yet another MM. So if you are the third one, please go ahead. And if you've already asked a question,
All
you
right.
could also lower your hand.
Okay, can you hear me?
Yes.
Can you hear me?
Yes, you're audible, please.
Oh, okay. Thank you so much. All right. So my name is Olajide Funshaw Benjamin from Nigeria. And just like Bab Miche spoke, who spoke earlier, said about persons with albinism, I would also like to know the intersectionality between climate change and health and persons with disabilities, because this is very, very important for us, especially within the disability community. But of course, I understand that you have a time frame for your presentation, and I really hope that when next you are going to be presenting, that you'll be able to tell us more about the intersectionality between climate change and persons with disabilities. Thank you so much.
All right. Thank you so much for raising this again. There's been a lot of literature about reducing inequalities and inequities when it comes to healthcare and also its relation to climate change. But as has been mentioned by two people over here, disabilities often gets a little sidelined. Um, but something that I did mention was disability adjusted life years. I'm not sure if you actually caught that. And what I'm going to talk about this both ways. For example, how this would affect somebody living with special needs and how this actually causes disability adjusted life years. For somebody who has special needs, obviously the kind of resources that they'd require would change, whether it's related to food or water, the kind of nutrition that they require. If a disaster hits, then they'd probably be very heavily impacted. They're definitely heavily impacted because they're not able to make it to time. But what climate change actually works when it comes to this particular scenario of special needs is how are you able to access these resources, whether it's food or water, because when droughts or floods and no matter what hits and you have these resource constraints, it doesn't reach, people with disabilities. And people with, okay, I shouldn't be calling them people with disabilities, people with special needs. People with special needs often have special needs because of an underlying disease in their body, an underlying comorbidity. And climate change affects our health, our human bodies and our human systems differently. And obviously, somebody who has an underlying comorbidity or an underlying healthcare need, it's going to be exacerbated by climate change for so many different reasons, whether it's the enzymes in your body working differently, it's a particular drug working differently on you, so on and so forth. Again, like I said, the literature in the space has been limited, not only in climate change, but in healthcare as such, and it's an up and coming topic. What disability adjusted life years means is anything that happens in our life, it adjusts the number of years that we're able to conducively live our life. The quality of our life changes based out of that. For example, if I'm being provided with the best possible nutrition, and I'm being provided with the best possible healthcare, and I'm doing everything to maintain my physical health and mental health and well-being, I'd probably live a better quality of life for a longer period of time. But say I'm not being provided that, then it's going to affect the quality of my life. Now, each time the disease or something hits a person, there's something known as the disease life cycle itself, which I think is a little out of scope here, but since it's been asked, it starts from before the transmission, your risk and exposure to it. And then you have the underlying thing where it's still incubating in your body. Then you have the disease actually manifesting in you. Then you have the immediate effect of the disease. And then you have how it's affecting you in the intermediate term and in the long term, so on and so forth. And at each given point of time, you have something known as primary prevention, secondary prevention, tertiary prevention. And when we look at disability and disability adjusted life years, we look at something on the on rehabilitation and how do we ensure that they're still able to meaningfully contribute, be meaningfully engaged, and be a part of society that welcomes them. That comes slightly towards the end, because the first and foremost thing that we're trying to do is prevent the person from actually getting it in the first place, like prevent the exposure in the first place. Does this make sense? I feel like I got very technical now, but I hope this kind of gives like some kind of an idea about how we look at the disease itself and how it's affecting human life.
I think that was a very kind of complex, but also all-rounded explanation. It definitely needs more time to go into details on that. So to the next person, I see Gabriel Aseka. You could unmute yourself and then ask your question. Gabriel, if you can hear. Okay, so let's go next to Rachel Ikomera and then maybe later to Gabriel. Rachel? Okay, we go to Twarita Bajoria.
Hi, I was just seeing this slide on potential regional temperature changes. So here I came across that change in maximum daytime temperature 75th percentile and 25th percentile. In the 75th percentile, on the world map, there are some red regions marked, and in the 25th percentile, there are few red regions marked. So what is this 25th and 75th percentile in this?
Great question. Are you familiar with how percentiles work in general?
Yeah, I know. I mean, till 25%.
No. Percentile is different from percentage.
Yeah, I mean, if it's 90 percentile, then means basically 10% of it is on the top.
No, it's the other way around. So population of the whole.
Your video just stopped. Yeah, now it's fine.
When we talk about percentile, it's like, okay, I'll put this in terms of growth percentiles because we talked about childhood stunting at some point of times. So for 50th percentile means that 50% of that population is going to be at that mark. Or if you look
Sure.
at people on either side. But when you look at 75th percentile, it doesn't mean 75 whole percent of like the population would be under you. But when you look at the growth statistic that it's going to, like the highest possible achievable attainable growth at that particular age, you're at the 75th percentile of achieving it. So when you
Sure.
project map something, and not projected to a percentage, because a percentage would mean that it's not accounting for anything else, any other variables that can come into the picture. But a percentile would be adapted to that and the changing population and the current trends of that particular area and everything. Does that make sense?
Yeah, I got percentile, but change in maximum daytime temperature, 25th percentile in brackets, and then it is 75th percentile in brackets. So, what
So
are the
it means that
difference?
25th percentile, if the temperature changes so much, like it goes to the 25th percentile of the projection, this is where the heat spots would be. But if it goes to 75th percentile of that projection, this is where the heat spots would be. Like the graph goes like that, right? Like it goes like that. So if you have the 75th percentile, you have so much under the graph. The area under the curve is so much. The 25th
Sure.
percentile at the end of the curve is little lesser, right?
Yeah. Sure, got
Like
it.
that.
Thank you. And
No
one more
worries.
question I had, if I can speak up.
Can we limit it to one question so more people can ask?
Sure, no
If that's
problem.
okay? Thank you.
Thank you. I see three MMs. So one of you can go ahead, and the last person I see is Elfrida.
Okay,
So
thank you. I'm Cynthia. I'm grateful for this presentation, but I wanted to digress a little because when my sister from Nigeria talked about the skin cancer, talking about climate change, you didn't have gas flaring, which some of us are experiencing here in Nigeria, which is also part of climate change because it emits the greenhouse gases and the noxious gases. So, and it impacts the earth because I'm a grassroots organization and I work with the community women, the marginalized. So I have carried out and I've done a research recently on the impact of gas flaring on climate change and the health of women. And some of the health challenges that you mentioned, they are part of it, but the majority are going through what we call skin cancer, which is one of the major health challenges that they are facing in face of climate change due to gas flaring. So I would love it if we could also do more researches when it comes to climate change and the causes and the underlying health challenges due to those causes. I hope you understand what I'm trying to say here.
Absolutely. Thank you so much for your suggestion and constructive feedback. And also congratulations on the research that has been done. With regards to the skin cancer, I think this will be the third time I'm saying it. My apologies. I was given just 45 minutes and I was covering very broad overview topics. Cancer was mentioned, non-communicable diseases and their impacts with climate change is again a session that I would have loved to take. So perhaps a note to the organizers, maybe specific impacts of climate change and health can be taken as a separate 45-minute session. I completely agree with everything that's being raised about skin cancer. There is a lot of data and research to support all the claims that have been made. And yes, in global south countries where we're exposed to this ozone radiation and even to sunlight for longer terms, we have an increased incidence of skin cancer and skin-related illnesses, especially since somebody mentioned, I think in the chat, albinism and so on and so forth. But please try to understand this is just an introduction. It's not something that's very comprehensive. I've just touched on like the very, very basics of the topics that possibly are in the news right now that have been looked at. And every single source that's been taken is something that's either been presented at like an international platform like the World Health Assembly, COP, SV, IPCC sixth report, so on and so forth, so that we give you like a very global overview of everything that's happened right now.
Yeah, so I think the point is that there is so much more to learn about the specific diseases that are impacted by climate change. And since there already are so many diseases, it's impossible to cover all of those topics in one session. But thank you for the feedback. I'll just turn to the chat now so that we don't forget them. And so Umesh asks how the climate change has differently affected developing and developed countries.
Okay, I actually have a couple of things that I can share on that. I mean, can I share my screen?
Yes, you should be able to.
Okay. Is my screen visible? Oops.
Yeah.
1 second. Let me just. Okay. So is my screen visible again?
Yep.
Okay, so this is something that was done by the Global Climate and Health Alliance, and it's called the Healthy NDC card, which basically talks about the different categories, its health impacts, co-benefits, economic and financing, monetary, and implementation. And this is specific to, this is the overview, right? So there's a bunch of countries ranked highest on who prioritizes health to somebody who kind of doesn't at the end. This is something that can be looked into to see how robustly a country is working towards including health in their NDCs and the implications of what it means. But what they also have is specific health cards and how it works. So this is the one on top here right now, Albania. So this is what they've looked at and they've ranked it. So this is one thing that can probably be useful, and you have it in different countries. But you also have why they have done that. So maybe let's go to Nigeria since we have a lot of people who've logged in from there. Right, we have Nigeria. So it mentions the intensification of climate-sensitive diseases, persistence.
Sorry to cut you short. This is Niger, not Nigeria.
Sorry, my
Nigeria will
bad.
probably still be up. I don't think they have Nigeria there.
Okay, my bad. Okay, maybe we'll do New Zealand or something. Or we'll find something else. I'm not sure.
You can do India. I know we have lots of Indians represented here.
Okay. Yeah, so India also has the 2022 NDC with its existing national action plan. It remains in force. So this is how India ranks so far on it, and how exactly what it means for the climate and health, because what we're doing for what we want as science is 1.5 and Paris Agreement says 2, but we're not really looking at that as India. We've like crossed the mark. But this is a good website for us to go to. Since somebody mentioned about how it affects different countries, I'm not sure if this is like really okay. So this is the Lancet countdown, and they've actually looked at stuff from different countries, whether it's heat-related waves, transmission. So here we can see how it works in the case of Vibrio. Vibrio is the one that causes cholera. I think somebody had put something on the chat box about that. So over here it says that the coastline puts more people at risk. This is what we need. This is how it's been rising. This is about, when you look at the Human Development Index and we're looking at climate change, what are the cities that are surveyed and how it's being overwhelmed by it. Heat-related deaths are projected to increase. And when you talk about heat again, like it depends on labor laws because it's connected to finance, so that decreases the amount of finance. And we can see that some countries have more heat wave exposure when compared to the others, depending on this graph. and then how electricity is being generated, so on and so forth, air pollution levels, company gases. It's very comprehensive. And they also have stuff that's dedicated to each particular region and to particular countries as well. So perhaps that's something that people can look into after we get off this call, like do a deep dive into the particular country.
Thank you so much for that response. We only have about 4 more minutes, so unfortunately, we can only take one last question. I'm gonna try to get one from the chat. And Awalu says, can climate change lead to diseases causing impairment? And if possible, what are the preventive measures to such? So this is a hearing impaired person, and so that's the question they're asking.
My apologies, I didn't quite catch the question.
Okay, so he says, or she, sorry, I'm hearing impaired and a deaf teacher. My question is, can climate change lead to diseases causing impairment? And if possible, what are the preventive measures to such?
Okay. Huh. Well, I'm not an ear, nose, throat specialist, so I'm gonna try to give a brief overview from what I know, and it's probably not going to be very comprehensive. But when we talk about hearing impairment or the disease related hearing impairments, there are multiple different factors for it. Sometimes it could be neurological, sometimes it could be because of an issue with development, sometimes it's because of exposure to sound pollution over short term or long term, so on and so forth. So it actually depends on a lot of different factors. And when we talk about climate change's relation to so many different factors, it again becomes a little more confusing. For example, if it's neurological and something that's related to brain, are we saying that this happened because of an exposure to a particular chemical, exposure to a particular microorganism? Um, is it because of something that was heat related that caused a stroke? Is it because of unhealthy food habit that ended up causing a stroke? Is it because of something that could have resulted in cancer? If it's something that is related to sound pollution, is it because they're living towards the industry? Is there any compounding factor based off that? If it's because of a developmental thing that, was because of the fetus that was inside a pregnant person, um, what was that person exposed to? Is this some toxins or heavy metals in the food and water? Is it radiation? It's extremely difficult to actually classify anything, which has actually been one of the biggest challenges in the climate change and health space. Like, how do you attribute one particular disease to something? Because when we look at the developmental of diseases, it's very multifactorial. It's when it comes to diseases that are caused by organisms, it's very easy for us to pinpoint and say, hey, this organism is causing this disease, and this is what the issue is. So we remove that organism, this person's going to become fine. But when we talk about non-communicable diseases, impairments, special needs, so on and so forth, it's always very multifactorial. It depends on a lot of things, even the genetic makeup of that particular person, so on and so forth. So it's extremely difficult to come back and say, hey, it is because of climate change that this has happened, and it's not because of anything else, if that makes sense.
Sorry. So attribution science is an emerging field of study where they really try to figure out if a disease is actually being caused by climate change or if there are other factors that are playing into it. So we've just touched on the basics of climate change and health. There's a lot more to learn and research on. So this is the end of today's session. There's been so much to learn even for us. We're going to now slowly start to wrap up, and I'm going to hand over to Damilola just to take feedback, and then I think we should end in 5 minutes after the half hour.
Thank you so much, Dr. Umesh. Once again, that was an amazing and full presentation. Like, I could see how you're trying to balance the complexities, and you're trying to take us through all aspects of how climate change affects health outcomes. And I love all the case studies that you've mentioned as well, and all the links to resources that you've shared. Please, everybody should know that all of those resources and links will be shared with you. We are going to send it to your email. So please don't be alarmed. And I can also see that Dr. Umesh has shared in our presentation our contact. So please feel free to reach out to her on LinkedIn. If you could please share your LinkedIn page again in the chat session, that would be great. But we want to say thank you so much for joining us once again. We really appreciate your time, your expertise, and the knowledge that you have shared with us. We really, really appreciate you. So thank you so much. So lastly, just like we said earlier, everybody is going to get links to all of the resources, the slides presentation, both the one from Dr. Umesh and the one that contains the program details. If you have any questions, send it to our email. But one thing we are going to quickly do right now is we are going to take a little bit of feedback on this session just to see how well you are integrated into the session. The major program feedback is going to come at the end of the program after the 4 weeks. So I'm going to share the link in the chat session now. So please just click on the link and just give us your opinion about what this session is to you. I can see so many people already saying, thank you for your session. Thank you for this great presentation. It's really nice to have all of you here today. And Dr. Umesh has also shared her email in the chat. So if you want to reach out to her, you can always do that. I know she also sent the link to the Youngo Health. So it's an amazing group to join. If you're interested in research, advocacy, please join the Youngo Health Working Group as well. I'm going to share the link to the Mentimeter again, just to have everyone click on it and give us your opinion on this session. So one other thing that I wanted to quickly address is that we've seen that so many people, we cannot really differentiate who is who from the that we are seeing on the charts right now. But one thing that we are going to try and do is how we are going to sort out the registration, the attendance links later. Would communicate that to you, but just always make sure that you join the meeting with the email that you registered with. Though all the subsequent links would not require registration, but if you join the meeting, all the subsequent sessions with the emails that you registered with initially, it would help us be able to track your attendance. So please always put that in mind while you join all the subsequent sessions. So I think with that, we have come to the end of today's session. It's really been nice getting to meet so many of you and connecting with you. Please feel free to share your not personal information, but maybe just your social media on the chat for any other person that wants to connect with you. I'm going to share the link to the Mentimeter again. We would love to have your feedback on the session. Mutule, is there anything else that we want to share? Okay, so I am going to